Good afternoon and welcome to government offices here in Douglas for this question and answer session, a vaccination special where you, the public, can put your questions about the government's vaccination programme to the people who effectively are responsible for it. Thank you for joining us. The amount of questions that you have submitted over the last 36 hours or so is vast. We will try and get to it as many as possible over the next hour or so. They range from booster jabs to PCR tests, isolation in children, second doses. We'll be taking questions about the vaccines themselves, of course, and of course the outlook here in the island in the light of the new variant. We're going to drill down a little more into specific issues that you want to know more about. So without further ado, let me introduce our guest this afternoon. We are joined by the Minister for Health and Social Care, Laurie Hooper. We are also joined on Zoom by Catherine Magson, the Chief Executive of the Department, and a well-known figure at these government media briefings, the Director of Public Health, Dr. Henrietta Hewitt. Good afternoon to you all. Thank you. Let me, just before we delve deeper, and this isn't the most important issue of the day, but a lot of people have asked, so I'm going to come straight to you, Minister, if I may, just for a recap. This variant has caused a lot of firms, individuals to cancel their Christmas parties, their festive get-togethers, and it would appear, and I appreciate we're our own island, our own nation, that there is a split here. I think I heard an eminent scientist say at lunchtime we should avoid all necessary socialising. Boris Johnson and Sajid Javid, the UK Health Secretary, said carry on, have your Christmas parties, nativity plays, concerts. So which camp are you in? Which camp is the island in?
It's probably fair to say the Isle of Man government is in the be safe camp, which in the context of having parties and going out to Christmas events would be to absolutely do them safely. So before you go out to an event, take a lateral flow test. You know, make sure if you're going to an event with an indoor space that may be poorly ventilated, wear a mask, consider social distancing if that's appropriate, actually take mitigation measures that are quite sensible would be the advice I think government is giving out to people right now. You know, we are expecting masks in indoor settings. We're not requiring any kind of mandatory measures out there, especially in hospitality. But really, you know, it is safe at the moment. The government advice is you can carry on living a normal life, provided, of course, that you take these sensible mitigation measures that the government is advising people to take.
And do you stretch that to public meetings and gatherings as well?
It stretches all the way, I think. So if you are hosting a public meeting, if you're a local authority, for example, you know, again, ask people to take a lateral flow test before they arrive. Make sure that anyone entering then is safe, you know, space the chairs out a little bit like we've done today. Just take sensible measures is really the advice at present. There's not too much to be overly worried about. Obviously, if the situation changes, then government advice will change. If we see spikes in cases, we'll have to step up advice and measures. But right now, the advice is, you know, actually there are concerns out there, so please take care to look after yourself, make sure that you're not putting yourself or others at unnecessary risk, and, you know, the absolute advice is when you're offered your vaccine boosters, please go and take them.
Socialise safely, that's the message then from the Minister. Right, without further ado, let's recap on the story so far, if I may. Looking at the official government stats and the initial rollout of the first and second doses, just to put it in some kind of perspective, 89% of the eligible population has had 2 doses so far. That's just over 64,800 jabs in arms. More than 68,000 people have received a first dose. That higher figure due to younger age groups, of course, only being offered 1 dose until now. The booster rollout's making progress. Just more than 42% now of those eligible having a top-up. That's older adults, health and care workers and people with some medical conditions. Almost 20,000 of the population has had the booster. So that rollout yet to reach the halfway mark as we go into winter, as we head into winter. Take-up has been slower for boosters, of course. We have heard concerns about that, about people not turning up for their appointments, and also around the Moderna vaccine, which is being offered as a booster along with Pfizer or Coronavac, as it's now named. That situation may be about to change. The emergence in the past week of this new variant and the extension of booster programmes to all adults. So just a recap of where we're up to. The government, of course, the Isle of Man government's announced this week it will follow the JCVI advice to offer booster jabs from age 18 up. Boris Johnson said last night the UK government will throw everything it's got at getting booster jabs and intends to give a booster to all under 18s, all over 18s, I should say, by the end of January. That's some target. So get the ball rolling. Let's get the ball rolling with a couple of obvious big picture questions, if I may. In that, does it make sense to ramp up the booster rollout when there is a lot we don't know about Omicron? Will the vaccines here work against the new variant? And in practice, how will the boosters be offered to the much larger number of people now entitled to them? Just a brief answer from all of you, please, if I may. I'll put the first one of these to you, Minister. Resources are already stretched in health and social care. Of course, we know about persistent high vacancy levels at Nobles, the recent suspension of elective surgery and other issues. So is extending the programme the right thing to do? Yes or no in a nutshell?
Yes, it is. I mean, the JCVI advice is quite clear on this, and they've been gradually moving down the age ranges as we've been going along. Obviously, Omicron coming out has made them rethink their approach, and they've significantly expanded the number of people eligible for a vaccine. Their advice would be it's definitely better to have it than not. Rolling it out quicker is definitely part of the solution. So yeah, it's been a bit of a shock to the system, I think. The significant number of people that have suddenly gone from being ineligible to eligible will take a bit of time to work out the details of how we're going to do that on the ground. I'm sure Catherine can provide some more information on that, but does it make sense to do this? Yes, absolutely.
And Dr. Hewitt, does it make sense to ramp up the booster rollout?
Yes, it does, and it does for two reasons, really. First, we have to remember that we are in the midst of a third wave of community transmission here, which is entirely Delta on the recent results, and that still persists. And we know the vaccine is very, very effective against Delta. So for that reason, people should definitely be getting their vaccinations and their boosters when they're eligible. In terms of Omicron, we know that there are issues with it, and in particular issues around the mutations on the spike protein in the Omicron variant, which make us concerned that the vaccines that we currently have may be less effective against Omicron. However, that doesn't mean that they're going to be completely ineffective, very far from it. They will just have a reduced effectiveness, but still a worthwhile one. And as with the difference between Delta and the previous variants, we expect that the protection from the vaccines will hold up well against severe illness, hospitalisation and death, but less well against infection and transmission. So for those two reasons, there is every reason to push on with the vaccine programme and the boosters.
You've just answered my two questions in one there. So thank you very much. That's excellent. Catherine Magson, I think the government said in a news release this week that extending the programme will be a major undertaking. Can we have an update on how you'll do this? Because more vaccinators and admin staff are presumably going to be needed for a start.
Yes, it's a huge, enormous undertaking, as you've just described. Just overnight, from Saturday to Sunday, it actually made 43,000 people eligible for the vaccine that we currently hadn't predicted at that point. So that gives you this idea of the size and scale of what we're talking about. So the vaccination board has been meeting over the weekend, daily since. Manx Care, who are responsible for the delivery of this, are actually working quite closely with a number of parts of the system, the health and care system, to see what is possible, the art of what is possible. So we are trying to, and will attempt to, increase our numbers of doses that we're currently planned to do before Christmas to start with. So we're doing about 780 a day. If we can, the aim, if we're trying to do, is to increase that to about 1,100 a day, which, if you remember, in the first set of the vaccination programme, which is what we're working with at full pelt. That does demand a significant number of vaccinators than we have at the moment, plus it also demands a significant number of administrators, not only in the vaccine hub, but also in 111. So the team are working at full pelt to try and manage that. They've gone out to, for example, community pharmacists to ask for their help, and I have to say the response has been fantastic. So it's just really now, at this moment now, trying to mobilise that, pull all that in place as quickly as we possibly can. So that is our priority. We will aim to try and increase the volume that we could do as soon as we possibly can. But as you've referred to, workforce is extremely stressed. I know that stretched, I should say, and individuals are actually already being asked to move from different parts of the system in Manx Care to come and support this programme, already to be able to make this vaccination programme work. So we're adding further to that now as well. So all options will be looked at. We will go as fast as we can. We have to invite people in the age group, which the JCVI is still saying we should prioritise an age group. We will aim to bring forward as much as we can. We have actually already booked appointments all the way until Christmas now, the 22nd. So if we're able to open up extra capacity, then our plan will be to offer those that haven't got an appointment in the older age groups to come forward, and then we'll go forward more and more through the age groups and down to the over 18s. We also
potentially, Catherine, potentially that was a Freudian slip when you said stressed and stretched. But in terms of beyond the short term, could this be appointments and walk-ins potentially?
So, yeah, it's a really good question. We have looked at both options. In fairness, managing walk-ins can be complex in relation to the paperwork that we have to undertake. So although we're increasing the administration in the centre, actually we've found that walk-ins, we're better off with a pre-booked where we can. So we are actually also working on, which is what I was just going to come on to, a booking system that will allow people to book, hopefully ideally pick out times, certainly days. I know the government GTS system are working on that at the moment. The team are working again on that full pelt over the last couple of days to try and put that in place. And we are actually planning on a future-proof booking system, but that'll be into the new year. But again, all to help those coming forward to reduce the admin that's involved in running this and the extensive nature that's involved in bringing as many vaccinations forward. Lots of different ways we can try and help with this, and a booking system will definitely help, we believe. But ultimately, the actual walk-ins worked better for us with the younger age groups, and where possible, if that's still the right thing to do, then we would look to do so. But at the moment, I think our plan is very much booked appointments.
You mentioned the younger age groups there. I just want to pick up on schools here. I just want to bring face masks into the equation because I've heard a number of suggestions today from different individuals and parents at schools where face masks aren't being worn. I mean, how do you police that? I know there's an element of trust, and is it essential?
So the government advice around face masks in schools at the moment is that they would be expected. I think that's the language we're using. It's expected that you'd wear them, but ultimately it is up to individual schools to decide how they will police that or enforce it. Ultimately, schools know their communities best, and they're in the best place to educate and inform and support people if they've got questions or queries or concerns about mask wearing or what to do in certain situations. There are also people, don't forget, who find it difficult to wear masks for whatever reason, medical reasons normally, and again, they've got to be taken into account. So it is very important, like I said before, about anything. It's about regular lateral flow testing, it's about taking sensible mitigations, making sure rooms are ventilated. All these things play a part. There isn't one silver bullet, unfortunately, that will solve all of our problems. So from the school's perspective, as a department, we're quite heavily engaged with the education teams at the moment, talking to the Minister about, well, actually, how do we roll this out through schools, and how do we support them, and how do we support schools in getting the message across.
Staying with face masks, Dr. Ewart, Ian is wondering, he says, why is essential medical treatment being denied for patients, is it, I don't know, who do not wear a face mask, who do not wish to wear a face mask, when a lot of the sort of eminent scientific and medical experts, and who, of course, the World Health Organization, agree that they do not in any way, he says, prevent the transmission of airborne virus. I'm sure you have an answer for that one.
I do. Now, I can't comment on the first bit of his question, which was basically a statement that people are being denied treatment. I'm not aware that that's the case, but that would be more one for DHSC and Manx Care colleagues to pick up. In terms of, and I forget his phrase, they categorically do not provide any benefit, and the WHO says so.
And prevent the transmission of airborne virus.
Yeah, well, that's just not the case,
I thought you might say
that. And if the inquirer would like to go to the WHO website or just put into a search engine WHO guidance on face masks, they'll be able to see what WHO does in fact say.
Thank you for your question, though, Ian. Just let me put an element of that to you, Catherine Maggs, and if you can answer that. It is essential medical treatment being denied any patients at Nobles who do not wish to wear face coverings?
So I think you find that the government, have mandated face masks in all health and care settings, but this is not unusual. In fairness, this is just reinforcing a policy that's been in place throughout the pandemic, and Manx Care have continued to do so. In fact, most settings, whether that's GPs, whether that's dentists, whether that's care homes, whether it's residential homes, have been asking for people to wear face coverings. We haven't particularly found any issues, any cause for concerns. We do help people in what type of coverings they should be using, and Manx Care have recently published something to help individuals around using medical grade masks, but it's not a particular cause for concern. It's not been an issue for us. We do ask people to do that. We ask people to provide details around contact tracing. We've done that throughout the pandemic. And actually the government has just reinforced the importance of that with the recent change in the regulations and making that mandated in supporting the health and care system.
Let us stick with the Omicron variant, because a few questions here that have come in I want to put to you, Dr. Hewitt. Will the existing lateral flow test register the new variant?
Very short answer to that, yes, they will.
Yeah. Let me get to the number here. I've got a number here from one, but the same member of the public. A claim here about vaccine injuries. Are you aware of this, and are these being investigated?
If the individual is referring to side effects associated with vaccines, obviously there is a long list of possible side effects, some of which are quite well recognised as being associated with vaccine, and details of them are available to everyone on the leaflet that goes with the vaccine, and indeed readily available on websites, so people can check those. Obviously, there may be rarer side effects, and in order to pick those up, the MHRA, which licenses the vaccines, has the yellow card scheme. Now, the yellow card scheme is a system for reporting adverse effects after any intervention. So that's any vaccine, any drug, or any medical device, and anybody can send in a report: a doctor, a nurse, other healthcare worker, the patient, patient's carer, family, friends, whoever. If you think you're aware of a side effect that occurred after an intervention, in this case COVID vaccine, then you can send it into MHRA.
So that's, taking up a question from Kelly as well, that's how you record vaccine injuries. I get the impression you don't like the term vaccine injuries.
I don't, because that sounds very specific. I think that may have been taken from the specific compensation scheme that the UK government offers, which I think is framed as a vaccine injury compensation scheme. But that is something quite different from the whole spectrum of side effects that you might expect to find following a vaccine.
Stephen appears quite angry, if I can say that. He's basically accused officials of lying about the seriousness of this variant. When he says both the Botswana Minister for Health and the scientist who discovered it said it's no worse than a mild cold. He says, I don't expect an answer or even this question to be asked. Well, there you go, Stephen. It has been asked. Who's taking that one? I think that's one for Dr. Hewitt, isn't it?
I'll take that one.
And then I'll come to you.
There are three features that matter for new variants. Those are: one, is it more infectious and more transmissible? Two, does it cause more serious illness, or indeed less serious illness? And three, can it evade vaccines? And as of now, we do not have good, extensive, real-world data to fully answer any of those questions. What we have is laboratory-identified mutations in particular parts of the virus which give us concern that it could evade vaccines. It also looks, from the data we have from South Africa, as though it may possibly be more infectious and may reinfect people who've recently had an earlier infection with Delta. But we don't have the data for that yet. When we come on to the seriousness of the illness, I think we've all seen accounts from doctors in South Africa who say that the patients that they've seen seem to have mild symptoms, but that is anecdote, that's not evidence, and we need that big data on these things to actually answer that question.
Let me ask you, if the variant impacts, as we're hearing in certain quarters, mainly on the young, could it flatline quickly?
Well, the issue with data from South Africa is that they have a very young population, and so actually that kind of skews whatever you see from South Africa.
Minister, I don't know if you wanted to chip in.
I was just going to say that's actually the point I was going to make. So only about 6% of people in South Africa are over the age of 65. So obviously on the Isle of Man we're triple that at least, if not more. So the population demographics are totally different. And if you read some of the responses and the interviews that the doctor who discovered this variant has given, she's quite open about her patients that she's seen. Were all young, healthy people. So it wasn't unexpected perhaps that they had more mild symptoms, but she is categorically clear that she is not sure of what the impact would be on older people, vulnerable people, people who aren't vaccinated. They're very clear about that what they know is what they're seeing on the ground is in relation to young, healthy South Africans, not necessarily people over the age of 65, vulnerable people, people who aren't vaccinated. All those questions really need to be looked into, and as Dr. Hewitt says, we don't have the data on any of that yet.
In terms of children and young people, I've got a bit of a two-parter here. when will there be a review from the government, Minister, on the impact of imposing, that, for want of a better word, that children isolate away from their own family members within their own homes? In other words, do they have to isolate away from their family within their own homes?
So the government advice on isolation, I think, has been clear from the start that actually when someone isolates, that does mean isolation. Clearly, this isn't going to be possible in everyone's home. I mean, not everyone has a separate wing of the house you can just put your family members in and forget about them. That's just not realistic. So I think the advice from government is where possible, you should isolate. But obviously, we're all people at the end of the day. You have to do what is sensible and what is appropriate, which is why there's a lot of guidance out there, which is published by Public Health or the COVID teams, talking about actually how you manage isolation sensibly, where the support services are you can access if you need them, where you can get help from things like food deliveries or other organisations that can deliver things like prescriptions. There's a lot of information out there on the website, so anyone who has concerns about how you would go about isolating with children, my advice would be check the website as your first port of call.
And you'll probably say the same again now, but I just want some medical advice in the second part of this question. Effectively, they're saying, why can not isolation be shortened when children start testing negative via a lateral flow test?
Because lateral flow tests are not actually as accurate as PCR. They're very good at picking up people with large amounts of virus in them and who are likely to be infectious. But when those levels drop, they will be less likely to pick up on an LFD. And of course, the household is by far the most risky place for transmission.
A question from Ruth, one for the Minister, Mr Hooper. Please can you clarify at what interval a PCR test should be arranged after returning to the island following international travel? It's really important, she says, that it's made clear, because she thinks there's been confusion in the media over the last few days. Presumably you can guide, I mean, that's all on the website, isn't it?
All the information is on the website, but
Yeah.
the regulations specify within 48 hours of arriving on the Isle of Man. So you cannot use a PCR that you've had done in the UK or further afield. The requirement is after you land on the Isle of Man, within 48 hours, you will need to have had booked your PCR and had that PCR test done. If you've travelled just within the CTA, so you haven't gone outside the United Kingdom or the Channel Islands or the Republic of Ireland, then it is within 12 hours of landing you need to have taken a lateral flow test and reported that back to the government. So all that information is available on the website.
It's all there, but thank you for succinctly putting that. Just before we move on to booster jabs, Kitty, I'll put this one to you, Dr. Hewitt. Kitty is asking if the vaccine is going to take 100 days to tweak, for want of a better phrase, for the Omicron variant. Is there any point to having her booster in the next month or so?
Right, I think I covered that in one of the earlier questions, which is to say that firstly it will protect you against Delta, which is the variant that's
rife,
circulating. It is rife, and the numbers are going up. And secondly, of course, although we expect that there will be some vaccine escape with the Omicron, it won't be total, so you'll still get some benefit. And thirdly, the 100 days, I think, is the estimated time for the actual pharmaceutical companies and teams to do the tweaking, but then of course that has to be turned into manufacturing and supply chain and delivery, which may take longer.
But just to clarify, you would encourage her to proceed with that?
With the booster?
With the booster, yes.
Absolutely,
okay.
absolutely. Best thing that anyone can do really to protect themselves at the moment.
Well, let's talk about booster, because Angela has asked, is the booster necessary for a person, and you've answered this in a way now, but I think she wants to know, when she's got no underlying health issues, she's already been double vaccinated, has since had COVID, she thinks she might have natural immunity.
She almost certainly will have some degree of, well, she'll have immunity both from the previous vaccination, and then that may well have been topped up by the infection. The issue with what people call natural immunity is that it is very inconsistent, much less consistent than the response to vaccine. And in fact, if anyone is interested and wants to look into the differences between natural immunity, so-called, and vaccine-induced immunity, the US Centers for Disease Control has done a very good up-to-date literature review and evidence synthesis comparing the two, and that very much comes down to get your booster or your vaccines when they're due, even if you've had previous natural infection.
I just want to ask you this. This came in quite late on, actually, from Lola. She says, if vaccinations work, then why are there any COVID restrictions in place whatsoever? I think we've answered that. But she says, COVID is endemic. Are you aware that being alive and living is not the same thing? I think that's worthy of an answer.
So
Minister?
this comes down to the question around things like civil liberties, I suppose. I was asked this at lunchtime, actually, on the Man in Line, a very similar question, actually, is this necessary? And I suppose the answer is it's a proportionate response to the risk that's being presented. And I think at some point, it is likely that COVID will become actually, like you say, endemic. It will be with us. And I think that's one of the things that some of us, I think, are thinking about with the Omicron variant. If this becomes vastly more transmissible but is much milder than Delta, is it actually something that is maybe a bit of a silver lining that's going to turn this into something that is more like the common cold, that is more endemic, whereas currently what we're seeing is not that at all. And so the question then becomes, what would be a proportionate response to dealing with a disease that has those characteristics? That would inevitably be a different response to what we're seeing right now. So in terms of what we're facing today with the Delta spike, the increase in cases we're seeing, the potential risk of the Omicron variant, actually the response we're seeing now and the government's put in place is a proportionate response to that level of risk. As the level of risk changes, so will the response.
Thank you. Catherine Magson, we have a number of personal cases here, which I'm not going to go into personal details about, but if I can sum some of them up, they're from people who have, in one case, an elderly wife, in another case, a grandmother. The gist is they're waiting to receive their boosters. They've contacted 111 a number of times to try and speed the process up, yet are still waiting. And of course, I think they're getting frustrated because, of course, so many boosters have been wasted in the last 10 days alone. What would you say to them? What kind of comfort can you give to them, those people?
Yeah, absolutely understand and can totally relate to people's worry about ensuring that they get their booster on time. First of all, it's really important at the moment that we were working to the 6 months, not the 3 months from their second dose. So prior to this weekend, it would have been driven entirely by that. There's probably a number of cases in there I suspect may even be housebound. And we have worked very closely to try and collectively work on a group of individuals per area. It is quite demanding from a resource perspective, and the team go out, just as they did in the first vaccination programme, in groups and pockets to try and vaccinate individuals, and they drive that by postcode ultimately. But if anybody is really concerned, then that they feel they have missed out, they're certainly past the 6 months at the moment, they've not received an invitation letter, and then please do email us, email 111, and we will absolutely follow that through and double check if there's any cause for concern. We have encouraged people in the communications, if after, say, 8 months somebody has not found that they've not had the vaccination invitation letter, then please do let us know. So absolutely sympathise and absolutely to try and do what we can, but we'll constantly communicate with people to ensure that they're clear when they're going to be invited and ultimately now how that's going to change.
There's about half a dozen similar questions here regarding the booster programme, the rollout, the speed of that. And again, thank you for all the questions, and we understand your concerns naturally. Very different scenarios for a lot of them here, and too much detail to go into within this hour. But I would like to mention a point Julie's asked. She wonders if the reason for the fairly low attendance for the booster is because the letters, they send out a specified time and a date for the appointment, whereas in the initial rollout, of course, folks were just asked, ring up, make an appointment, off you go.
Yeah, I think that's a good call. We've looked really carefully and hard about what's made the difference. In fairness, it's a blend of different factors. The Moderna vaccine did cause us the most concern, though, and we've talked about that in communications last week and certainly press releases and conferences that the Minister also did and myself last week. So where we saw a double amount of what we call DNAs, do not attend for Moderna, we think that was a misunderstanding in fairness, and we've tried to share that information with the public to reassure them the importance of turning up for both vaccines, and they're both equally important to take and both equally valid. In reality, we're going to do all that we can to bring forward as much as we can. We constantly focus on reducing wastage. We constantly try and do what we can to improve the processes that we're undertaking to bring people forward. We have scaled down the 111 system over the summer. We are putting more administration back in now as a result of the news over the weekend, which I referred to earlier. And we're also bringing forward an immediate solution around people being able to book times and slots themselves. So we do hope in the next few days, certainly in the early part of next week, to have launched that, all being well, subject to testing, will allow people to pick a date and a time. For really the message though is at the moment you are giving your letter 2 or 3 weeks hence. So if you do find that that doesn't work for you, please do call or email 111 and they will look to try and rebook you and put you in at a different time. So there should be enough time, to be fair, for people to be able to make that change if that appointment doesn't work for them. Thank you very much.
Minister, a question from Maureen. Booster jabs are going to be necessary, even 3 to 9 months or so indefinitely, she says. Is there a reluctance to set up hubs in towns? Why are most of the island population, in effect, having to travel, in some cases, fair distance, to Douglas for vaccination, why they don't have to for flu jabs? Is there a reluctance?
No, it's a good point. I mean, I'm obviously a Ramsey member, and my constituency is quite often, I think, in this particular situation where we're told, actually, you've got to go to Douglas, you've got to go somewhere else. And some of it is down to the way the vaccine has to be delivered, so it's not quite as straightforward as the flu jabs, for example, in terms of the way it works. And so sometimes it's actually, if you think about the number of staff we need right now just to man one hub, as soon as you start talking about multiple hubs or pop-ups even, the number of staff you need actually rises exponentially. And so a lot of it is down to how do you get the most people vaccinated as quickly as possible, because that's ultimately the aim, is getting as many jabs in arms as quickly as we can. And if we can do 1,000 people a day, 1,100 people a day at the Chester Street hub, but if that number drops to 800, 900 a day if we have to go out into the various towns, I think you default to getting as many in as possible. So I have talked with Catherine and the department about actually what do we do about this. So there will be some people who can't travel, who find it very difficult, and so we are looking at, well, actually, could we do some hubs towards the back end of January, possibly, when we've got through the massive kind of the nub of the work, get through that, and then say, right, who's left, and can we do some hubs, maybe in Ramsey, maybe in Peel, maybe wherever, to try and mop up then people that for whatever reason would have struggled to get to those Chester Street hubs. Don't know whether that's going to be possible yet, but it's something we're definitely looking into.
Well, watch this space.
Yeah.
Okay. From Maureen to Michelle, question for Dr. Hewitt. Why is so little advance information sent for the booster jab in relation to the brand you receive? Actually, Catherine Magson may want to take this one, actually. Advance information, she says, for the initial doses was very good and allowed individuals time to do their own due diligence. Not so now, is the gist of what she's saying.
It does vary, to be honest, depending on what clinic. The clinic that's running, depending on which vaccine we're going to be using. So that's why we can't necessarily always confirm, and also the deliveries that we receive on island. So we do advertise when people arrive up at the clinic, but we've also provided a lot of information on the website that allows people to do that due diligence on ultimately both vaccines. So it will be one or the other. We are required by the UK, in which where we supplied the vaccines, to use X percentage of each vaccine. In effect, actually, that increasingly is Moderna, because we're being asked to focus the Pfizer on the younger age group where that is approved for. So we are thinking about, one of the things we touched on is taking into account that delivery I've just talked about, and also our ability to plan the clinics, that we probably would start to publish, perhaps on a weekly basis, which vaccines we are going to use, because at that point we will know. So it's something definitely in our mind to try and help people. But ultimately, both vaccines are very, very safe. We encourage people to take up whatever vaccine they're offered. And clearly the clinical team, when people are having the vaccine, are very happy to talk through with people at that time and at that moment if they do have any specific questions.
Well, we've talked about children and young people. Let's just move on to sort of the students, slightly older young people. Suzanne wants to know, will Category 4 young people and university students be called for boosters over the festive period, over the Christmas holidays, including those, in some cases, who've had one jab on Ireland and the second jab in the UK? Will they be entitled to be vaccinated here? I know it's not as straightforward as that, but will there be a possibility of some boosters taking place in the festive break?
Again, this is down to workforce and trying to plan as much as we can. As I said, everybody is very, very stretched. I know the Manx Care team are really focused, and there's a real call to arms gone out around trying to make sure we've got as many vaccinators and administrators as we can to make this programme work as fast as we can. So the team are looking to see what they can do during the non-bank holiday days in between the festive period. At the moment, we've planned until the 22nd of December. If we can open up clinics, whether those are walk-in or pre-booked during that festive period, then I know everybody will be focused on ensuring if we can. If we can't, then it will be ultimately, as we plan to do, through into the early part of January. At the moment, prior to the announcements over the weekend, we expected to be able to offer everybody a booster in the categories that we'd had up until the 24th of January. So that was our original time frame. Ideally, we're still working to that time frame, but with bringing people forward and with a greater number of pay. So that is our plan. But again, it's all going to be down to the workforce, our ability to deliver this as fast as we can, and ultimately people turning up on time and allowing us to plan accordingly in the same way we've just talked about a few moments ago.
So in terms of a second vaccination being offered to 16 and 17-year-olds, no timescale fixed as yet?
No, we will definitely offer as soon as we can. We do recognise that second dose needs to be done. The time frame has been brought forward, and it would be our intention, as we did before, to offer walk-in clinics for those. Ideally, I think the team are thinking about a couple of weekends' time, but again, that's still got to be firmed up, and again, it will be dependent on the workforce. But we will do as much as we can, as quick as we can, and I can assure you that everybody is really focused on getting as much vaccinators and administrators available to do so. But again, the plea is out there. If anybody does like to get involved, would like to get involved, then we'd be really happy to hear from you.
Elspeth and Melody, thank you for those questions collectively asked there. This has caught my eye, actually. If I can just stay with you, Catherine Magson, that the Pfizer dosage regime states that all people over 12 should receive 2 doses of the vaccine for full protection. And Dr. Hewitt, of course. With this in mind, why are we only offering our children between the ages of 12 to 15 1 dose of the vaccine, which doesn't give them full protection, that this questioner is asking?
Right, again, this is based on the expert guidance from the Joint Committee on Vaccination and Immunisation, and they pondered long and hard on the guidance to give for young people, because the risk profile for young people is very different to what it is for older people. Overwhelmingly, young people who get infected with COVID have very mild illness, mostly asymptomatic, and with less sequelae. They have lower incidence of long COVID type issues. So when you're making a decision about whether to offer them an intervention, a vaccine, you have to be really careful about that balance between risks and harms. And so that was why they went for 1 dose, because obviously there is less risk of reactogenicity and serious side effects with 1 dose. But as the risk profile changes with the arrival of Omicron, then clearly the assessment of that balance changes.
So while the Isle of Man government has generally been following it, in this case it's not following the JCVI advice?
Yes, it is, because the JCVI advice has changed.
Right.
Yep.
Okay, thank you. Let's talk about another one, actually. Drew is asking this. I'll stay with you, Dr. Hewitt, if I may. Coronavac. It's been approved for travel purposes by the UK, Ireland, the World Health Organization, amongst others. Manx people living abroad who've received it are still treated as unvaccinated, Drew says, by the Manx authorities, effectively preventing them from returning home for Christmas. Is this something you're aware of? Not at all. No. Okay.
I thought we had moved in line with the UK.
My understanding was that decision was already made.
Right. Okay.
I'll double check that. I'll take it away with me and make sure it has been done, because my understanding was we are mirroring the UK and recognising those vaccines for travel. If
that isn't the case, Drew, we will. The department will endeavour to get in touch with you on the address you contacted with this question. Thank you very much indeed. From Karen, just one more on this, because I appreciate there's individual cases here. She is immune compromised and has been advised she'll require a 3rd booster. Her question: how is the 3rd vaccine different to the booster? And is AstraZeneca being offered as a booster? And if not, why not?
Right, if we go with the first part, which was how is a 3rd dose different from a booster, the 3rd dose is very specifically for people who have compromised immune systems. And the issue there is that people in that category do not mount the same response to vaccine as people who are not immune compromised. So the idea of the 3rd dose there is to give their immune system another push to try and bring them up closer to what people who are not immunocompromised would get. And then the booster would come subsequent to that to keep the levels going.
Yeah. And just in terms of the second question, is AstraZeneca being offered as a booster?
No,
it's not
routinely.
No.
And the reason for that is that the studies that looked into the effects of a booster dose actually found that the effects were larger with mRNA vaccines. So that's why Pfizer and Moderna are what is used standardly in the booster programme. However, if somebody cannot have an mRNA vaccine, Pfizer or Moderna, and had a previous course of AstraZeneca with no problems, then they would be offered AstraZeneca.
Linking that to, let me ask you another here. In terms of, Stacey's asked this question. She's got COVID. She recovered without a vaccine. She'd like to ask, I think I know the answer here, why she should have the why she should have the vaccine.
I think we touched on that earlier.
It's the same message.
Exactly.
Yeah.
The inconsistency of the response to infection compared with that to vaccine.
Okay.
So we would recommend that everybody has the vaccine when the expected time interval has lapsed.
And again, talk about, thank you, and again, we could talk about individuals' stories all night, but I do want to just touch on a few people who've with allergies or concerns about adverse reactions who have contacted us. One is due for their booster soon, and they're asking, why aren't we publishing data? And there's a good reason for that, isn't there? Is it the wider scale that's being published?
There is. I mean, as we've touched on, this is really what we're talking about in terms of the MHRA yellow card system.
Right.
And basically, you report into that anything that you think was related in time to the vaccine. Now, most of that is just association, and as anyone who's done basic stats course at school will know, association does not prove causation. So you cannot say that just because somebody experienced X within a certain time after having Y, that the two things are causally related. It could just be totally coincidence and chance. So the way to explore that is to build big data sets in which you can actually statistically analyse and see which associations are actually coming out as statistically significant, and then you can start doing deeper work, experimental work on it to try and understand that. But you cannot prove causation from an observational study, which is effectively what the yellow card is.
And does this yellow card system provide feedback in great detail?
Yes, it does. Yeah. The figures for the UK and the Crown dependencies aggregated is actually publicly published at intervals. If you want to ask for the Isle of Man data, you can do so either by writing directly to MHRA, just writing to them or emailing them, or putting in an FOI, and they will actually then give you the disaggregated data for the Isle of Man. But the numbers are so tiny and the range of reported reactions is so wide that you can't actually make any statistical sense of it, which is why we don't do any analysis of it ourselves on island.
See, just staying with the yellow card, Rosie's quite strong on her views on this subject. I've read quite a lot about from the same lady on social media, actually. She's basically saying, and to summarise, how many people on the island are suffering with severe vaccine side effects, first of all, and what are the policies and support in place for them?
We currently do not have that evidence to help us understand what might be definable as definite severe vaccine side effects. That just isn't there. There isn't, something you can consult that says X, Y, and Z are severe vaccine side effects. We know what we expect of the commoner ones because, as I said before, that's set out in the leaflets that go with the vaccines and is available readily on websites. Anybody who is suffering from clinical signs or symptoms, whether they think they might be related to vaccine or not, needs to go to the doctor and get them thoroughly assessed.
But because she's saying that there have been reports within this scheme on this subject of cardiac disorders and worse.
Those are associations, and because cardiac disorders are actually very common, it's perhaps not surprising that some seem to be associated in time. Similarly, the most severe thing you can think of is actual death, and actually, yes, people do die within reasonable time frames of having had a vaccination. It doesn't mean the vaccination caused it. But that is why we need these big data sets in order to tease out some of this.
And some of these people who've suffered an adverse reaction have been unable to work, and worse, of course. Will there be some level of support for them Catherine Magson, or Minister, I should say, really, for these cases. I mean, again, it's a claim here, but certainly there have been a number, in the hundreds, of adverse events reported to the yellow card scheme for COVID-19 vaccinations administered on the Isle of Man.
So again, coming back to what Dr. Hewitt was saying, that's you can report anything to the yellow card
Sure.
scheme. So if you get a headache after getting the vaccine, you might think I should report this because maybe it's connected.
But there are some at the serious end.
There will be, absolutely. So there's nothing stopping you, something happening the day after you've had a vaccine or 6 days. You can't say that actually because I had whatever the effect was that it was definitely the vaccine.
So what
I would say to people though is exactly the message. It doesn't matter why you're ill. It doesn't matter why you have symptoms. Go to the doctor. The social security system exists to provide support to people who can't work. All these systems, they don't ask you why you're off sick. They don't ask you what it was that caused your illness. What they ask you is, are you able to work? Do you need income support? Do you need incapacity benefit? Those systems are all in place and are all equally accessible to anybody, irrespective of what their illness is or why they have an illness.
Who is responsible for collating and monitoring the safety data that's coming in from the vaccine rollout regarding vaccine adverse effects?
Well, that's the MHRA through the yellow card scheme.
They will do all of that.
They do all of that. They are responsible for the whole field of what is known as pharmacovigilance.
Has there been a rise, do we know, in heart attacks, seizures, strokes, other cardiac events related issues since the rollout began?
Nope.
Nothing official on record. Okay. I want to mention the NHS app because I know certainly a number of people who are raving about this. Catherine Magson, you'd urge all islanders to sign up to that, presumably.
Yeah, we would. I think you also may have seen the news today that the actual app is now available. Previously, individuals were, from August onwards, were able to download off the website, but now the app is available, which obviously makes it easier for people to freely use if they have access to technology. You can still ask for a hard copy letter. And actually, similarly, you'll find in the next few days that booster vaccinations will also be visible for everybody to see. So we made some really good progress, and we'd like to thank the UK for assisting us. It's been quite a long, complex process to get to this position, but it is now available. Encourage people to download and use the app accordingly, yeah?
This is something that the department's keen to push, Laurie Hooper.
Well, it really isn't anything about us pushing it. It's most of Europe now requires you to show some kind of COVID pass when you travel. The UK requires it when you're leaving, coming from the UK. The Isle of Man will be using it on our borders. So ultimately, if you're travelling, it is advised that you get something like this. You can use the letter, you can go on the website and download the information. But actually, if you've got a smartphone, the app itself is pretty useful. It's pretty helpful. It has all the information on there. It's nice and straightforward. So yeah, if you're planning on travelling, I would definitely encourage you to use the app if you can, just because it's for me at least, it was the most convenient way of accessing that COVID information.
What is in place for the winter, Catherine Magson? I mean, I know you at the moment it's the booster rollout, and it's literally on a day-by-day basis from what you're saying. But what is the sort of medium to longer term plan for the department as far as preparation is concerned? I mean, how difficult are we expecting this winter to be compared to last winter, when obviously I think it was January before the vaccination programme effectively started?
It's a constant pressure, it's a constant demand. Everybody is very stretched, as I said. It's a natural time of year where that is the case, but we've overlaid COVID, living with COVID, we've overlaid an unknown flu season, respiratory viruses, and all the pressures of that built-up demand over the last 20 months. So it's a circumstance that nobody's ever seen before, but we're all expecting it to be particularly difficult. It does change. Some days can be better than others. That's quite usual. But the team in Manx Care have a very strong position in place for how they manage that, what actions that they take, and accordingly they then work with the department on a wider system support that they may need and wider government support. In fact, and tomorrow we have another session again where we're all sitting down together across the government along with Manx Care and just working through and saying, what if? It's called part of our scenario planning and scenario testing. If this happens, what would we do? What would you call upon? What extra resources could we divert? And you could argue the vaccination programme is a good example of that. We've just been identified and notified that we're going to have to deliver another 43,000 vaccinations very quickly. So what do we do? How do we prioritise? How do we risk assess? How do we move resources around? And how do we manage demand? The health and care system is very used to doing that. But I don't want to underestimate the unprecedented circumstances that everybody was working with at the moment, and accordingly take the opportunity to thank everybody for the work that they do. It's just phenomenal, and is a really attribute to what everybody plays their part in the health and care system. So yes, this work will continue. It will be part of what we do between now and certainly the early spring. And we'll do everything in our power to be able to keep people safe and manage accordingly the demands that we face.
I don't want to put words in your mouth, Minister, but how difficult is that? Because with the best will in the world, the island's health service, and we're not alone in that as an island, has been stretched to the limit and beyond at times, not just this year, but particularly in the last 6 months, where there haven't been sufficient staff at times to deal with not the basics, but certain other matters. I mean, how difficult is it?
Very, in a word. It isn't an easy thing to manage, and I think Catherine made the point, and the only point that I think we can make here is the only way we're able to do what we do at the moment within the health and care sector is because of the dedication of the staff that work there. I think they go above and beyond on a daily basis, if I'm honest, and I don't really know where we would be if we didn't have such a dedicated and caring workforce, because some of these questions are impossible to solve. You know, how do you have people manning all the various testing and vaccine services as well as managing the hospital and the communities and the GP's practices and everything else that goes on? Actually, it's hard enough to do that without layering COVID on top. And so the short answer to your question, how hard is this? It's very hard. I think if we didn't have such committed and dedicated staff, it would be nigh on impossible.
But how do we attract and recruit more? Because we are understaffed. There's no two ways about that. And this is something that your predecessor and the predecessor before him and her, etc., have experienced.
Yeah, part of it I think is about some of the changes we're making now with Manx Care, with the new independent inspection regime, and actually demonstrating some of the things we can and do very well on the island. Part of it is working with the Department for Enterprise on their locate plan to actually showcase what the island is, and actually what you find. I spent 5 years in the Enterprise Department, and what you find when you are talking to people about the Isle of Man, it's not a hard sell. Actually, the Isle of Man is genuinely a good place to live and work, and most people here actually appreciate that, and quite a lot of people from other parts of the world, we don't realise how much they envy some of what we have here. And so selling the island as a place to work isn't too difficult. The challenge then comes when people are trying to relocate, and you have all of the other issues that we do face sometimes around, you know, potentially housing costs or childcare or university fees or whatever it may be. And that's the work the government needs to do now more broadly, because this isn't just an issue for the health sector, it's an issue for the private sector as well. How do you get people to kind of, the Isle of Man's great, but how do you get them to take that leap and actually move here and take up one of these jobs? That is the next big challenge, I think, for this government.
What would you say, Dr. Hewitt, in terms of trying putting some reassurance for those who are very concerned? I mean, we heard at the start of functions, events which have been knocked on the head, and there will be more to follow. And as the Minister said, you know, safety is paramount. But what would you say to sort of reassure people that perhaps we don't need to panic about this new variant?
We don't need to panic about the new variant because we don't yet know exactly what it means.
I don't know if that's reassuring, though.
It's honest,
yeah.
and we have to be honest. So we can't tell people exactly what impact it's going to have. There is no way at all of doing that. That will become clearer over the next 2 to 3 weeks. And in the meantime, we really need to keep on doing what we already know we need to do around the Delta variant, which, let's not forget, that is circulating here. As you rightly said, it's rife. The numbers are going up at the minute, and that's not surprising with the change in the weather and changes in people's socialising and behaviour. Spread of COVID is very dependent on subtle changes. So just subtle changes in behaviours at a population level can drive quite marked swings in numbers. So really all that comes back to is reinforcing what the Minister said at the beginning about everybody remembering what we need to do, using the LFDs, actually thinking about whether we want to socialise or not. For some people the answer will be yes, with the supportive mitigations like LFDs, masks, keeping a bit of distance, checking the ventilation, frequent hand sanitising or washing. They will feel happy to go out and socialise. Others may not feel that confident, and if that's the case, then they can make the decision that's right for them, and others should respect them for that. And as I say, the advice that we can give around the Omicron will become clearer over the coming weeks.
And Catherine Magson, if I can just turn to you finally, we're not, as a department, are we looking at very much living with this now for the near future? I mean, there's no plans to perhaps experience some of what we had to experience earlier this year and indeed last year. And I'll put this to the Minister in a minute as well. But is certainly that the rationale behind your department's thinking?
Yeah, I think the health and care system as a whole, we understand the message. This is about living with COVID. We'll be treating it as any other infectious disease. We've been working that way for some time, and each lockdown actually that went through, even over the last 20 months, we've been trying to open up more and more services, and very much focused on running business as usual as well as in the COVID pandemic. So yeah, absolutely, we can't afford not to. We've got pent up demand that I've talked about. We need to keep people safe, we need to treat them as fast as we can, and we're very much focused on making sure that we can spin all of those plates at all times. There will things that come our way that means that we can't in certain circumstances, and we will communicate with people accordingly. But absolutely, everybody is really focused on trying to make sure that they can maintain services as well as living with COVID.
Minister, I know in the last administration, some ministers were for lockdown, others were opposed to it. That's nothing unusual. Politicians disagree, of course they do. But we're not even, lockdown's not on the horizon in the foreseeable future, is it, in the Isle of Man?
So if you look at the Winter Framework document that was published, I don't think anyone can make that commitment. What we've said in the Winter Framework is there are 3 levels of where we may have to go.
Yeah.
You know, level 1 was the base level where we were advising people to wear masks and advising people to take regular lateral flows. Level 2, where we're at now, we're expecting more wearing of masks. It's mandatory on public transport. It's mandatory in health and care settings. We're now strongly advising people to take regular lateral flow tests before they go to an event, for example, or twice a week anyway, just as a matter of course. The 3rd level of that Winter Framework, if these mitigations don't work because people aren't following them, that 3rd level does talk about legal mandated measures, and that could very well include everything from mandating masks in more places right the way through the full gamut of options all the way to a potential lockdown. I can be absolutely categorical on this. Nobody wants that. There is not a single person that I've spoken to within the Council of Ministers who is in favour of let's lock us down. That is not something we want to do. We are absolutely committed to saying, can we stay in level 2? Can we maybe tweak some of these measures, make some of those subtle changes that Dr. Ewart has talked about? That's where ideally we would like to be. But ultimately, this is all about managing the risk to the public. And if we don't see the kind of response that we are hoping and expecting we will get from some of these measures, if we don't see this have the positive impact of containing the spread, if we do see pressure on the health service that we've already talked about, if that pressure starts to become too much, then we will unfortunately have to escalate through that Winter Framework up to potentially legally mandated measures. So that's where we are at the moment. Level 2. Please follow the rules, please follow the advice, please make sensible choices and be responsible for yourself and for others. Please help us do our bit to protect the health service. Those are the messages we're trying to send out, but ultimately I can't make the promise that legal measures won't follow if they have to, but no one wants to go there. If we can avoid that, we will do our best to avoid that, but really it's not up to us as government, it's up to everyone on the island to each do our own part to be responsible and help do what we can to combat this virus.
We are out of time. Thank you to our healthcare professionals for your frank and honest assessments this afternoon. The Minister, Laurie Hooper, on Zoom, Catherine Magson, the Chief Executive of the Department of Health and Social Care, and the Islands Director of Public Health, Dr. Henrietta Ewart. Thank you very much indeed. I think we've got through probably about 4/5 of the questions. Sorry if we didn't quite reach all of yours, but hopefully we've given you a flavour, and perhaps there'll be an opportunity to do this again soon. But from all of us, thank you very much. We'll leave you with a reminder of who is eligible to receive a booster, and in the meantime, thanks very much for your company and stay safe.